Are you thinking of getting breast augmentation done? You want to make your breast size larger, but you're confused. Should you go with implants? Should you go with fat grafting? Which is right for you? Today, to answer these questions and hopefully solve your doubts, I'm Dr. Aniketh Venkataram, plastic surgeon at the Venkat Center, Bangalore. Now, breast augmentation is the name of the surgery given to increase the size of the breast. A lot of women have smaller breasts than they would like, and this can lead to a loss of confidence. And increasing the size of the breast is a great way to improve your body image and get your confidence back. Now, the way to do this, there are two main options. One is breast implants, the other is with fat grafting. What does this mean? So in breast implants, we're using an implant like this, which is made up of something called silicone. And we place this behind the breast, and this is what makes the breast bigger. In fat grafting, instead of using an artificial implant, we remove some fat from your stomach and we inject that into the breast, and that's how we make the breast size bigger. So which one should you go for? Let us look at 5 differences between breast implants and fat grafting and what are the advantages and disadvantages. Number 1, anesthesia. Breast implant surgery is done under general anesthesia. It's a short procedure. It takes around an hour to do, and it's a daycare procedure. You go home the same day. Fat grafting, on the other hand, can be done under local anesthesia as well. You can give local anesthesia to the place where you take the fat from. You can give local anesthesia to the breast, and you can inject the whole thing under local anesthetic. Number 2, the scar or the incision. For breast implants, we make a cut below the breast that is around 1 inch long, and through that cut we place the implant. For fat grafting, we make smaller holes, 2 or 3 of them, and we inject the fat using small syringes. So there is a more noticeable cut with the implant compared to fat grafting. Number 3, the size increase. Here, breast implants can give you as big a size as you want. Now, having said that, there is an optimal range for each patient, so we judge and see what is the best for each patient. But typically, you can expect an increase of 2 or 3 cup sizes with a breast implant. With fat grafting, however, the amount of fat which survives determines how big your breast will become. All the fat that we put does not live. That fat has to get blood supply, and the fat which lives is what ultimately increases the size of your breast. And here, fat grafting, typically around half to 1 cup size is what you can increase. So you can get a bigger increase with implants. Number 4, the post-op course. What happens after surgery? With breast implants, that gives you an immediate result. You know what it is right away. And over the long term, they work very, very well. However, 15 to 20 years after the surgery, you might have to change the implants if something happens to them. With fat grafting, you will get to know the full result of the surgery 3 months after the surgery. That is when we know how much fat has survived. And this fat behaves how your body fat does. So if you lose a lot of weight, some of that fat might go away. So in that sense, it can fluctuate, whereas a breast implant result is stable. Number 5, are there any other benefits? With breast implants, one big benefit is it does not affect your ability to screen for breast cancer. The implant is present behind the breast, so the breast can be screened for breast cancer very easily. Whereas fat grafting, you're putting fat into the breast, and it does not increase the chance of cancer, but it might make it more difficult to detect cancer, especially on an MRI. However, one advantage with the fat grafting is that you're also doing liposuction. So you're removing fat from another part of the body, so that other part of your body is becoming a little bit thinner. What this also means is in very thin people, you might not be able to get enough fat to do the procedure. So what is the bottom line? They both have their advantages and disadvantages. For those who are looking for a larger increase in size, the only way to do this is with a breast implant. There is no way to increase a very large increase in size with fat grafting. For those who do want a very big increase in size, a small increase is enough, and they don't want a large scar, then fat grafting is better. So different strokes for different folks. You decide what is best for you. I hope this video was helpful. Do like, share and subscribe to our channel. Let us know in the comments if you have any questions. Thank you. Have a great day.